Many thanks for joining us on today's episode of Healthy Living. Healthy Living is a health magazine program specially put together to not only inform and educate you, but also make you feel relaxed and smile. I'm your host, Folashade Ogurinde. Now, as you know, Healthy Living has 3 segments: the Vox Health segment, the Health Talk segment, and also the Health Trivia. So this is what we do on the Vox Health segment. We take a random sampling of public opinion as well as test their knowledge on topical issues with regards to the health. Moving next is the Health Talk. What we do here is that we have professionals who cut across the health sector give us detailed analysis of health issues, more like having a one-on-one conversation with your personal doctor or health worker. Next is the Health Trivia, specially designed to do nothing else but to make you smile. Well, they say laughter is good for the soul. Now let's move straight to the topic for today, which is epilepsy. What exactly is epilepsy? Do Nigerians even know what epilepsy is and what causes it? Is it even contagious? Well, let's head to the streets and find out.
Seizure, and it has to do with the brain. When there's a seizure in the brain, it sends signal to the body, so the body is stiff, and probably the person falls on the floor, and maybe for the next 2-3 minutes, the attack comes. Then thereafter he gets himself. But I don't think it's I don't know if it is it affects some other person when you try to help them.
People said it is being caused by when someone swallows a lizard. That is the reason I know about it.
Okay, do you think it's contagious?
I've heard about it. They say it is hereditary. So if someone's father or if it's in someone's family, someone can actually catch it. That is what I know. I don't know any other way that you can contact it again.
Epilepsy is a common disease. In some rural areas, very common, in the suburb, understand? And when you talk of epilepsy, it's like somebody experiencing something like acrobatic. That person will be twisting on the ground. And after a while of settling down, if you leave him on his own, he will get settled. They call it in Yoruba language, warapa. Some be on hereditary. Some develop it personally. But I don't know whether through the consumption of food, something that they have an imbalance, what do they call it, this combination? Combination of this medicine, they call this one name, balance, food balancing. Abi, when you are experiencing wrong feeding, you are not eating well, you are not eating balanced diet, definitely you will experience some sickness in you, and which turn at the end of the day to hereditary to the children that you were born if care is not taken. Epilepsy is an embarrassing sickness. It can come up anytime. It can act on anybody at any time, the moment that person is having that problem. But what I'm made to understand is that in the African method, they have their own traditional means of putting an end to it.
I think it's a disease or a sickness though, where the patient, or let me say the victim, has to release fumes. But I don't think it's a frequent something. Maybe it comes. But I don't know if there's anything that triggers it or something. I have no idea, but I think it is though.
I don't know. It's a disease. So actually it's common. I won't say it's common, but I know it's a disease that happens to most of the people that I just say. Yes. What I do have, they said is contagious.
Wow, epilepsy I know is a hereditary disease, and once it starts, it hardly goes, but then it can be controlled. If you know that your child have an epilepsy and you begin to take care of the child from when it's an infant, you can really get it off the child's life. Yes.
Epilepsy
Epilepsy, according to my own understanding, can be, a sudden disorder that can affect the brain, as in electric.
I don't know. I don't really know what causes it, but when it happened to them, it made them unconscious. So they won't really know themselves again. So that's all I know about it.
I don't know. I just know that it has to do with brain, mental dysfunction issue. Because when it occurs, God forbid, I've seen someone that has that is in that health situation. So it's very unpleasant. It's very bad. So I've seen the way they act. I think it's from the nervous system. I think it's from the brain. So.
Welcome back to the show. From the Vox Health segment, you can see that less than 2% of our respondents really know what epilepsy is all about. And since the show is all about enlightenment and education, let's head straight to the Health Talk segment, where Dr. Alayaki is on standby to tell us all we need to know about epilepsy. And watch out, is also going to bust some myth about epilepsy. You don't want to miss this. Don't go anywhere. We'll be back shortly.
Hello out there, I am Dr. Adom Alayaki. I'll be talking today on epilepsy. I know most of us are familiar with what we call epilepsy, but we have wrong notions about epilepsy, about people who suffer from the disease. And I want to throw a little light on what is epilepsy. We know we have brain, and our brain is like the engine room of whatever we do, all the activities we do. If I move my hand, it is the brain that is controlling it. And when you have excessive electrical discharge coming from the brain, it can result in seizures. That's what we call it. That in common parlance we call epilepsy. There are different types of seizures. If I'm mentioning seizures, epilepsy, it is the same thing. There are different types of seizures. You can have focal seizures, like my hand going like this. This is a focal seizure. It will be going on repeatedly. It's a form of seizure. You can have generalized tonic-clonic seizures, in which the patient, the person, or the sufferer will just be checking. There's always an aura that will precede the seizure, and the patient may lose or may not lose consciousness after episode of seizures. What are the causes of seizures? Number one, in neonates, in small children that suffer what we call birth asphyxia. What is birth asphyxia? When you deliver a small child or a neonate that did not cry, that did not inhale air within the first minute of life, that did not cry on time, which means that the brain will suffer some asphyxia. What is asphyxia? Supply of oxygen into the brain. It is not adequate within the first minute of life. Some of them may go ahead and develop what we call seizures. Number two, when you have a growth, something that is growing, we call it space-occupying lesion in the brain. Number three, when you have severe head injury that affects the brain. Number four, some form of drugs. Electrolyte imbalance. Number five, cancer, either from the brain or spread to the brain, can result in epilepsy. And who are the sufferers? Like I said, even from a day-old baby can suffer epilepsy or seizures to an adult. Will it result in shortening the life of the patient or not? Yes and no, depending on what is causing it and how you manage it effectively from when you discover, or you are doing the other way around. Epilepsy, when it comes, how do we manage them? We always advocate once you notice that somebody is having recurrent seizures, you must take them to the hospital. There's a difference between when you have what we call febrile convulsions and seizures. What is febrile convulsions? This one occurs in a small child. Some school of thought will say between 5 months and 5 years. Some will say between 6 months and 6 years. When a small child suffers fever, to the point that, you know, the brain will cut it off, will just cut off and say, look, do something about me. And the patient will now have convulsion at the height of the fever. It's different from what we call epilepsy or the regular seizures we are talking about. That one, after that age of 5 or 6 years, is going to stop on its own, whether you have fever or you don't have fever. But we don't want it to progress, because for each episode of febrile convulsion we are having, there's always a damage to the brain. So we always tell mothers, when you notice that your child, your baby is having fever, rush that baby to the hospital. Give paracetamol, take it sponge, and take it to the hospital for appropriate treatment. Would such a child can progress into having epilepsy in the future? Yes or no, depending on the background of that baby. So, like I said, if somebody has a severe head injury and it's not properly managed, after the person has come out of the treatment, can progress to having regular seizures. If one has a space occupying lesion, like a tumor in the brain that is compressing, part of the brain, one can be having seizures. Like I said, there are other conditions too, metabolic disorders, electrolyte imbalance that can result in seizures. Are they treatable? Yes, they are treatable. And I want us to know that nobody can contract seizures via the body fluid, either from the urine of somebody who is suffering from it. Well, I think I don't want to waste most of our time. I want us to go on break before I come back to talk on that and talk on the complications it can have. Welcome back. Before we went on break, I was talking about the body fluid of sufferers that people think that they can contract the disease from. You cannot contract from the urine, either from the feces, from the saliva, or any fluid that is coming from the patient. Neither can you contract it by touching them. Because we know that a lot of sufferers that we see by the roadside, either in classrooms, where they work, people neglect them. They will beat their tongues, they will even injure themselves. Some will even have seizures and enter into fire. But because some of us are afraid that if you touch them, you are going to contract the disease, please, that notion should be, that erroneous belief should be erased from our minds. You cannot contract it because it's something that is coming from the brain and it is not due to infection. So it is not contagious in any form. Can somebody inherit it? It does not even run in the families. Whether the father, the mother, there may be some conditions, some problems that may run in the family that basically will not cause seizures. But part of the signs and symptoms may be seizures. If it runs in the family, they can have it. But seizure on its own is not something that runs in the family. Because they will say, oh, you cannot marry from that family. One of the children has epilepsy. No, it is not. And how do we help the society? Whoever is suffering from it, please, when you see them, let us quickly help them. We can guide them while the seizure lasts. Make them lie on their side, either right side or left side. Turn their head to one side so that the tongue will not fall back to block the airway, or they will not aspirate their saliva. That will shock them in the long run. So when you help doing that, by the time the seizure will have lasted, they will come round and they can get up and help them to the hospital where they have treatment. And I want to tell those who suffer from it, you can go to the hospital where you'll be given treatment, you are given drugs, and they will tell you how often you'll be taking your drugs. If you are taking your drugs as a when due, you may not suffer seizures unnecessarily. Number two, if we know what is causing it, that space occupying lesion, once that space occupying lesion has been removed, that tumor or what have you has been removed, you are back on your feet. If one has head injury and you are adequately treated the way you're supposed to be treated, it will not leave behind something that will be causing seizures for you. So we want to implore our people, And when you now see a small child, and we've been telling people, when they tell you in an ordinary hospital that, madam, it's as if you are going to have this child by yourself, you might have some complications at the end of the day. You may seek for second opinion. So that by the time you deliver your baby, you're not going to have a baby with bad asphyxia that may end up giving us these kind of problems at the end of the day. And we make sure that at any point in time, any ailment that we see, like I said, I talked about metabolic disorders, that we see in ourselves, in our children, in whoever is surrounding us, we should go to the hospital promptly, appropriately. Appropriately, what I mean is that you see a specialist in that field that will manage you, and you'll be all right. They're not going to be, a danger or endanger your own life at the end of the day. Because if you have seizures while driving, if you have seizures maybe near fire or what have you, or where they are cooking, you can injure yourself. But if you know you have that ailment, you go to the hospital appropriately and you take your treatment. And if you are taking your treatment, you keep on going for checks until you are certified fit, maybe to go off your drugs or to reduce your drugs you are taking. Can it reduce life? Yes and no, depending on what is causing it in us. If what is causing it is something we can control and you are well controlled, you will live the normal lifespan. But if something like cancer or tumor in the brain that is coming from the brain itself, it's possible it might reduce someone's life. Another thing I want to talk about in the elderly, those who suffer stroke. Some of them do have seizures because stroke on its own is a problem of the brain. Maybe you have hemorrhage, you have bleeding into the brain, or you have a blood clots into the brain. So it's possible that the patient, may suffer seizures. And once we treat appropriately, it may reduce. But in some people, they keep on suffering it until death comes. But we'll give palliative treatment so that they will not be suffering the ailment. So what are the complications is what I've just said, and how to manage it is that you make sure you go to the hospital. And to our viewers at home, when you see anybody with epilepsy, anybody with seizures, don't run away from them. You cannot contract the disease from them via maybe touching, or you use the same cup, or you use the same towel, or you use the same clothing. Help them so that they can help themselves. The little I have said, I hope the sufferers of this disease, people around them, and the general public, you have learned one or two things, so you will not stigmatize those people with epilepsy. And those people with epilepsy too should not stigmatize themselves. They should come and let people know, so that when they suffer it, they can have help, and they should go to the hospital for their regular medical checkup.
Thank you, Dr. Olayaki, for letting us in on all we need to know about epilepsy. Now let's move straight to the health trivia segment. And today we are asking, if you were to be a drug or a medicine, what type or what kind would you be? Be prepared to be amused. Don't go anywhere. We'll see you soon.
Vitamins. I want to be vitamins, okay?
Blood tonic. Oh God. Oh, and it's okay.
How can I tell you? Paracetamol. Because it's popularly consumed by the people in the universe, so paracetamol will be very common.
I think I will be the drug to tackle malaria, to eradicate it completely. Yeah. Because I don't really like that malaria fever symptoms.
If I was to be a drug, I can't be a drug, please. I can't be, I'm a human being.
I think something like Novocaine is okay for me, because what we experience in Nigeria is more energetic, that makes someone to weak. More so in Lagos State. You do a lot of trekking, you do a lot of hustle and bustling. So when you are using malaria tablet in Lagos State, it's like you are wasting your time. But what you need to do in the case of malaria, you can consume water oftenly. But in the area of energetic, then it's better you take Novocaine, something that can make you feel relaxed in your pains.
I will be a medicine that can maybe cure headache or pains to make the body lively, that's all. Malaria. The reason why, okay, malaria is often common among people. It's a common sickness, all I put it. So I would like to be a malaria. Yes.
Thank you very much.
Thank you. I'll be diclofenac. Diclofenac is a brand of painkiller. Although you have different diclofenac, you have diclofenac potassium, you have diclofenac with paracetamol. So I'll be a diclofenac. Because I want healing now. I want to heal pains. So why not?
Let me say an HIV drug. Because I believe presently that is the scarce commodity that every medical doctor are trying to seek for now, to get the drug that can work for that. And since that has not happened, that is what I could wish to, if I happens to be a drug.
Welcome back to the show. Well, when we were out on the field, they responded through that question back at me and said, "Madam, what kind of drug or medicine would you like to be?" And I responded and said, "I'd like to be a portion of happiness. Take one daily and be happy for the rest of the day." Anyways, that's all we can take on today's package of Healthy Living. Do join us for more exciting episodes next time. Till then, take care and bye-bye. I'm your host, Folashade Ogurinde.